Um, there are guidelines regarding National Spinal Cord Injury Strategy year 2012. These guidelines indicate that any major trauma center should get the spinal patient within 45 minutes. If the patient is near any other hospital and a restrictive care is indicated, a trauma CT scan should be done and the patient should be then transferred within 4 hours to the spinal injury unit. They also reiterate that the spinal shock is basically a injury which causes no loss of reflexes, tone, and power below the level of the injury. Incomplete injury is one which does have some sensory distribution. Moreover, checking the flexor pollicis longus function and sensations at the saddle area would help to indicate whether the injury is complete or incomplete. The spinal shock ends when the bulbocavernous reflex comes back. This can be checked in a catheterized patient with tucking the catheter and contraction of the tartos muscles. NASES 1, 2, 3 have indicated that there is no role of steroids itself. It increases complications and immunocompromise a patient with a spinal cord injury and has shown no benefits.